On the Medical Watch, AI helping interpret complicated medical test results.
The simple effects earning a local medical student a place in history. WGN's Dina Baer has the story.
The Northwestern student grew up in Vernon Hills and is now a finalist for a National Innovators Award by the American Medical Student Association. There is a big cash prize to bring his dream to life, a first-of-its-kind app to help people improve heart health.
We believe that this can help them down the road mitigate their cardiovascular risk and lead healthier, happier lives.
A bright idea led to many long, dark nights in front of his computer.
We've been developing this application for the last year. You know, this started as a simple idea back in April 2024 of how can we make patient tests explainable to patients? And through a year of blood, sweat, and tears, many late nights, we have this minimal viable product.
Northwestern medical student Tyler Smith, also an AI expert, put his two loves together with one lofty goal: beating heart disease.
It is the #1 killer. It is the #1 most expensive, and it's on the rise as well. So this is a really important aspect of health to be tackling.
Through complicated algorithms, Tyler hopes to change the statistics regarding test results.
What we're doing is taking your personalized lipid results and making them explainable to patients.
As part of an annual physical, or when doctors suspect looming heart troubles, they order a lipid panel.
Patients get just a big sheet, of many terms that are medical jargon: triglycerides, HDL cholesterol, LDL cholesterol, what's the good one, what's the bad one? And then not only are the terms confusing, but there's all these ranges.
Enter Lipid Llama.
I did the science, I did the design.
A human designer collaborating with artificial intelligence. The result? Answers immediately.
Hi, Llama. How were my cholesterol results?
These results are for a 55-year-old test patient. Llama raised the red flag.
So your triglyceride level of 180 is considered high. Triglycerides are a type of fat found in your blood, and high levels can increase your risk of heart disease.
Very simple language.
Yes, and that was the goal. We've really curated this to deliver impactful statements that are succinct, accurate, and understandable.
So you had to put in all of that data on the back end so that then it spits out to him on the front end here.
Correct, yes. So I collected a large amount of patient education documents about heart health, heart-healthy lifestyle, high cholesterol, blood tests, anything imaginable that a patient might ask about their heart or their blood test is probably in that database.
In addition to model patients, Tyler tested it on some very important people.
I've had my mother and my grandparents run through it.
And what did they think?
My mom loved it. My grandma loved it.
Not available to the public yet. Now the scientists are set to judge for a prize worth $125,000. Additional income for this AI.
We've been lucky to reach the finals, and I'll be pitching there on Friday.
Are you nervous?
Very nervous, but also very confident.
And he's confident if he gets the prize, he can have the app tested and up and running by next year. Go, Tyler. Back to you.